Hello, my name is Dr. Siobhan McHale, and I'm a consultant liaison psychiatrist who works in a general hospital, that's Beaumont Hospital in Dublin, with patients with medical and surgical health problems and their associated psychological or psychiatric comorbid conditions. Half my job, I work across the general hospital, in emergency departments, with different groups of patients who have cancer or various other health problems, or patients with alcohol-related difficulties. And half my job is working with patients who attend the renal service, in particular, patients who attend the renal transplant service in Beaumont Hospital. Firstly, I would like to start by looking at the different language that we use when we talk about people with health problems. We tend to separate out these health problems into mental health and physical health, rather than talking about health as a single concept. I will use the example of diabetes as a condition that most people are familiar with, in which the main organ involved is the pancreas. The main neurochemical is insulin, and the management is comprised of lifestyle management plus or minus medications. We all accept this as a socially valid, real illness. If we use a similar model when we think about depression, what might the main organ be? In depression, the organ that is affected is the brain. The main neurochemical you may have heard of is serotonin, and the treatment is again comprised of lifestyle management plus or minus medication. And yet depression and other psychiatric disorders are often stigmatized, viewed as a failure of the person for not being strong enough, that it's not a real illness. And yet there is no difference between these constructs or these conditions. Nobody says you're addicted to your insulin or your high blood pressure tablets and when are you coming off them. And yet this is the language frequently used when the organ involved is the brain. And the brain with respect to how it responds to internal and external change. And this is the area I would like us to focus on. So we are reframing this is to an overview of health, where a person may have a range of co-occurring, or what we call comorbid conditions, which may occur together. For example, cystinosis with renal failure and high blood pressure and an anxiety disorder. And ensuring that each aspect of this health journey is addressed with appropriate evidence-based interventions to ensure the best response to treatment and the best quality of life. So any chronic illness will have an impact based on how we respond to it, how our environment supports our health difficulties, and this will be very varied between the individual and the circumstances and at different times of the health journey. And sometimes it will have less of an impact, and other times it will have a greater impact. So the journey of any chronic health condition can feel like a sword of Damocles, hanging over one's head while waiting for the next challenge of the health journey. If I have cystinosis and I have renal monitoring, when is my creatinine going to show that my kidneys are under strain? Then when will I need to progress to dialysis? When I'm on dialysis, when will I get a kidney transplant? All of these, the different stages that we anticipate as we try to live in our day-to-day lives. Similarly, as family and carers for people with cystinosis. We project to the future for the different stages and the different challenges of the health journey. And it is important to emphasize that distress is normal, that these are normal reactions to an abnormal situation, and that through each of these stages we can have different emotions, including shock, anger, denial, sadness, before moving on to acceptance, similar to the phases of grief. These are our body's healthy, appropriate ways of adjusting in order to process and accommodate this change. And we use our physical and psychological aspects to adapt to this response. And we know there are many changes that need to be adjusted and responded to in coping with the impact of our chronic health condition on our relationships, on our body image, coping with having a fistula if we require dialysis, the impact on our self-esteem if we are unable to work, the changes that occur in our leisure or in our work, financially, difficulty with travelling, with holidays, a whole range of impact that we have to process and adjust to. And so it is important that we get the balance right. We don't want to over-medicalize normal distress, which relates to adjustment and healthily adapting to conditions. But equally, we don't want to miss significant psychological problems that can add to the overall burden of the health journey and that we know will respond to the correct treatment. One of the questions might be, why is this emotional distress, this psychological impact of our health difficulties missed? And there are a number of possible reasons for that. One is the understandability of the emotional response. Of course, a person will feel very upset and distressed when they have to cope with these difficulties. The possibility that this emotional change or tearfulness or tiredness or withdrawal might be due to the underlying health condition itself. The unsuitability of the clinical setting for discussion of a personal nature, and the stigma of approaching the consideration of whether a person might have psychological difficulties, and often this tacit contract between the patient and the health caregiver. If you don't ask me how I'm feeling, I won't tell you. And so we can ignore this part of the health journey. So the question might be, why does it matter? Why do we need to consider the impact of psychological factors? And we know there's a whole range of aspects in which medical or physical condition affects our level of activity and our level of function. But the addition of significant psychological burden and emotional distress will add further and reduce our quality of life even further. As has been previously emphasized by the physiotherapy talk, 50% of the disability of most chronic diseases are due to the underlying disease process, and 50% due to the process of deconditioning itself. The process whereby if we don't use our body, we lose more function. Hence the importance of collaborative working with healthcare professionals and self-management strategies. Keeping mobile, keeping active. The body is literally a use it or lose it machine. For patients who require dialysis, and indeed for any patients as part of this health journey, it's important to be aware that we're all different. We all respond differently to various types of stressors. But we know that chronic illness is associated with increased rates of anxiety, depression, and other disorders of the brain. These quotes relate to a summary of the range of responses in a group of our dialysis patients. How am I going to take care of myself? I'm not going to think about it until I have to. It's too much to handle. I'm tired, depressed, stressed. We know that depression affects 20 to 30% of people on dialysis. Anxiety affects 20 to 40%. And a significant number of patients at some point may have difficulties with their memory or cognitive impairment. These challenges are not just due to reactions to the meaning of the health problem, but also a direct impact of the inflammatory processes on the brain. And the response of our autonomic nervous system, that's our fight or flight system in our body, which is triggered in response to change or danger or threat, and causes a whole cascade of physical changes in the body. This cascade in relation to threat, coming from prehistoric times when we were geared to respond to tigers running out after us, is just as active in our modern day bodies and brains. And so if we perceive danger within our body or in our environment, our heart will start to beat faster to pump more blood to the muscles. This is with the aim of helping us to run more quickly or to fight with more strength. Our breathing speeds up to get more oxygen moving around. Our pupils dilate to see more clearly. Our hearing becomes more sensitive so that we can hear everything. All these changes are adaptive in the context of danger, such as somebody running after you with threat. But it can be very confusing if they occur in the medical setting. Are my palpitations or shortness of breath due to a problem with my heart or lungs? Does it mean that my condition is worsening? Or are they due to an adaptive anxiety or stress response in this difficult health situation? And so we know there are many benefits of learning to manage stress, not just the psychological benefits of improving our attention, our memory, our energy levels, but also the direct physical benefits. We know that by managing stress effectively, we can reduce our heart rate, our breathing rate, bring down our blood pressure, improve our immune system's response and our wound healing, and allow our body back into an equilibrium, a healthier balance, what we call a homeostatic phase. If this stress response, this fight or flight, goes into overdrive, it can manifest as anxiety. The sense that something bad is going to happen, I won't be able to cope. And our body's alarm system is triggered and energized for fight or flight. And there are a range of interventions, cognitive behavioral therapy type interventions, as well as medications that can be really helpful in dialing this down. So that when we get shortness of breath, if we can differentiate it from the increased fluid overload of deteriorating renal function, from anxiety, then we can get the appropriate treatment for the appropriate symptom. Equally, the stress can manifest itself as depression, a sense of I'm useless, I'm worthless, everything's hopeless, associated with increasing fatigue, doing less, difficulty in concentrating, staying in bed, staying at home. And you can imagine how this might be difficult to differentiate from the fatigue of the underlying health condition itself. It can affect our motivation to engage in treatment, again including physical activity, all of which can have an increasingly disabling effect in our health journey. Again, cognitive behavioral approaches that relate to thinking differently, doing things differently, and perhaps the role of medication, if indicated, can be very effective. And it is important to emphasize that treatment for these conditions, the same as treatment for your high blood pressure or diabetes, can be very effective in controlling these symptoms and improving your overall health journey. Anxiety management interventions, one-to-one or group support, cognitive behavior therapy, and antidepressant medication when indicated, the same as insulin when indicated for the management of diabetes. All of these are important, and treatment of these very treatable conditions is associated with measurable improvements in physical health as well as in well-being. Now, this is a busy slide, but I'm showing it to outline the stepped care approach in our renal transplant service, ranging from general information to one-to-one individual work, and where this fits across all stages of the renal journey. In the green section, from pre-dialysis and chronic kidney disease, to the blue area when a person is on dialysis, and then the orange area where the person is in the transplant phase of their journey, and the important contribution of a whole range of members of the multidisciplinary team, and the importance of incorporating a stepped care approach, including psychoeducation. That's lots of information about the various aspects of the journey, and also with regard to management of the emotional challenges across all stages of the renal journey. I'd like to say a particular word about live donor transplantation, which is a very important consideration that a number of you may have to make with members of your family or friends, and how we can ensure the best outcomes for both recipient and donor. And emphasizing that among the highest priorities are the protection of donors' well-being and the prevention of adverse consequences of donation. And these relate to not just adverse medical or physical consequences, but also adverse psychosocial outcomes. And by this I mean adverse somatic complaints of fatigue and pain, where the donor is left feeling weakened or more vulnerable to health problems. Psychological distress, where the donor becomes more anxious, or the impact and strain on family relationships. And we know historically that over half of all donors, despite rigorous evaluation protocols, have previously had some challenges in these areas. But now, with increasing research and evidence, we are aware of how we might predict and how we might intervene to minimize these adverse effects. So in the same way, if we pick up that somebody has high blood pressure when they come forward as a potential donor, or that they are overweight, we can help and give them support and intervention with regard to addressing that, so that their options of becoming a healthy donor increase and the outcomes are best for the donor and recipient. We know, for example, that residual ambivalence, which we can measure by a questionnaire with regard to a person's worries or concerns as a potential donor, are important because these can be a consistent predictor of poor psychosocial outcomes unless they're addressed pre-donation. And we have interventions often associated with increased education and knowledge and information that can be very helpful in addressing this area to give the best outcomes. Post-transplant, it's very important for the patient who's the recipient of the transplant to focus on self-management strategies. I often compare the pre-transplant and post-transplant journey to the antenatal and postnatal. So in antenatal planning for having a baby, the focus is not just before and the delivery of the baby, but also how to care for this baby for the next 20 to 30 years. Similarly, for transplant and having a kidney, how to be in the best condition and health for caring for this kidney for the next 20 to 30 years. Because this is very closely associated with maintaining graft function, overall health, and quality of life. A central feature of which is taking the anti-autoimmune therapy medications consistently. And so this is a busy slide, which is a conceptual model for kidney transplant recipient self-management. And as you can see, the patient is at the very center of this in the orange area. But all around this is the support of the family, the community, the healthcare system. The importance of self-monitoring, and now we have increasingly developed virtual clinics, IT and apps that can help with this self-monitoring in terms of maintaining good health and minimizing the recurrence of any complications post-transplant and moving forward. So looking after one's physical well-being involves taking medication regularly, symptom management and infection control, maintaining good health through diet, exercise, self-monitoring, weight management, not smoking, attending all medical appointments, and self-monitoring for any adverse events. What we know with regard to renal transplant is that the commonest cause for losing a kidney transplant is because of not taking the immunosuppressive medication in the appropriate or accurate way. A large amount of work and hope and cost goes into moving towards transplantation. And so the importance of having adequate information and support to maintain the wellness of your transplanted kidney for many years ahead. So non-adherence, not taking your immune suppression medication accurately, is associated with increased acute rejection of the kidney, a 7 times higher loss of the transplant, reduced renal function, and increased healthcare costs compared to patients who do take their medications accurately. And for some reason, perhaps because there's the background option of dialysis, but the non-adherence in immunosuppressive medication is highest in kidney transplant patients compared to heart, liver, or lung transplants. So there's an increasing emphasis on supporting this aspect of healthcare and also the aspect of emotional well-being. empowering yourself by learning about your condition and treatment and being an active self-manager, setting realistic goals and plans, seeking support. In Ireland, we have excellent support from the Irish Kidney Association counselling service, as well as from the transplant team. Taking care of yourself and knowing when to seek professional help. And we have guidance from the Emotional Wellbeing, Book 6 of Living with Chronic Kidney Disease, IKA and Beaumont Hospital book series. We have a range of supports that are accessible. Mindfulness and Relaxation Centre, based at Beaumont Hospital, but can be accessed anywhere in the world. If you just Google www.beaumont.ie/MARC, Mindfulness and Relaxation Centre. And this will take you through a range of different relaxation and breathing techniques, as well as introducing you to mindfulness. There are a number of other resources you may be familiar with, one of which is the Patient Buddy Transplant app. And this will increasingly come to the forefront of our modern healthcare service moving forward, in particular after the impact of the COVID-19 pandemic, where patients will become remotely able to access their healthcare information and then be able to select out with their healthcare provider when are the times when they do need to come in to be seen, and when are the times when they can use self-management strategies and remote support. I shall end my presentation at this point. I'm very happy to be a source of further information at any time